Perdón. El sonido está bien. Aquí, ¿no? Aquí, sí. Para abajo, para arriba, ¿no? Sí. Puedes estar listo. Les doy 2 minutos más y empiezo. Yo te lo doy ahí. Gracias, Gonzalo. Nada. Good afternoon. My name is José Jonay Ojeda. I am the responsible and the coordinator for the working group on quality and safety in the Transplant Child Network. And this afternoon, we will present a webinar around how we are planning to launch the activity survey for last year. And also, we will also talk about the annual data update that the network is launching. First, as I said, I work at the Hospital Universitario de La Paz. I'm the hospital quality manager, and I'm coordinating this working group. Please, I would also like to point out that our technical director is Dr. Lars Wemberg from the Karolinska Hospital at Stockholm. And as I mentioned, this webinar will introduce this issue that we did in the previous one, when we show us the continuous monitoring and quality improvement system of the network. That, as I remember, we pointed out that integrated the evaluation level, both at the European Commission level, the Transplant Child Network, and the healthcare providers members that belong to every network. As program, as you may know, in the last board of the network that took place in Padua, we established a formal system for monitoring the compliance on the general and specific operational criteria that are already set by the European Commission, and also on our own activities that we have established quality indicators, quality standards. All European reference networks and all the healthcare providers that are considered full members are required to report activity for these quality monitoring and quality improvement system at least annually. The requested data in our case may also include a compliance check by every healthcare provider on specific quality standards established by the network. The last survey and the first annual assessment took place last year. On previous webinars, we talked about and safety survey. The first one was launched last February the 8th of 2019 to all the 18 healthcare provider representatives that belong in TransplantChild, actually. And at that point, the deadline we had was extended until the 15th of April of 2019. That was the date when the DG Santé closed the possibility to add additional information on the activity of the networks on the previous year. On our side, we met last year in Madrid in the board of the network that took place in May, and at that date we presented the first results of the survey and we closed it. The reported healthcare provider activity at that point included quite an important amount of transplantation performed by all the healthcare providers belonging to TransplantChild. In total, 663 transplantations. And it's important to point out that we have detected that there's still some transplantation programs that are being carried out by our healthcare providers that are not being reported to TransplantChild. That's also an important point that we have to remember, because there's still room to have more activity under our network. Lastly, but not least, the results were again presented in order to be validated at our last board of network, who took place in Padua last November. These are some of the results we presented in that board of the network. The results were validated by every representative after the board of the network, and in some cases modified because they were not valid. You can see that in the year 2017 we had a fair amount of activity in all the hospitals of the network, and as it was stated when the network started, at least our hospital have to undertake one type of transplantation and the follow-up of another transplantation. That's the minimum criteria in order to be present in TransplantChild. The year 2018 have a similar scheme, as you can see. Again, a big number of activity when we sum up all the transplantation programs that are reporting activity to TransplantChild. And at this point, I would like to specify that you can notice in the slide that some programs that are marked with yellow in the slide are those that we have detected through another initiative of the healthcare working group that was the map of transplantation, that we know that those hospitals have activity in those programs, but the actual representative doesn't have the possibility to give TransplantChild activity reports of those programs. As you can see, there are still 6 hospitals. We can add more transplantation types to the activity of the networks, but well, that's room for improvement that we hope to get into TransplantChild in the following years. And moreover, as you probably know, TransplantChild focus not only, and that's an important issue that we have to focus on, also focus on the activities that the patient goes through before transplantation take place and also post-transplantation. As you can see, there is an initial outpatient visit when a patient is evaluated for transplantation, and then if that evaluation is positive, that patient usually gets into a waiting list in order to wait for transplantation. the same time, post-transplantation activities are also variable. That does not only include hospitalization care, but also a series of patient visits during the follow-up of the transplantation that include the treatment of complications that may arise and that follow up, but also the family and social support that these patients needs, and when they come to an age, the transition to adult setting that must be prepared also according the nature of the specific transplantation that it has been done. As you can see in the slide, asked through the survey about the activity that was undertaken by our healthcare providers in those aspects. And out of 1812 provided data on the pre-transplantation patient evaluation, 11 provided data on the number of patients that they have in waiting list. We have to remark that in this case, the waiting list cannot be generalized to the hematopoietic stem cell transplantation. And 14 out of 18 provided data about the number of patients that were being followed up in patient care. We have to stress out that this is a big issue for all the European reference networks. Part of the success of the ERNs is that we have real information and valid information about the new cases that are being attended by all the healthcare providers within the respective networks. It's a core indicator, and it's a key issue that we are able to get this information and to see how through the years we can achieve a bigger coverage in order to attend European patients through these networks. Well, a short summary about the outcomes of this first annual survey. It's important to stress out that finally all full members of the networks participated in 2019 in the first survey. It is true that two of them were not able to provide information in the period given. One of them provided after the date that was set up by the European Commission, but before the Board of Network that took place in May. And the other one provide this information after the Board of the Network that took place in Padua. This is an important issue. All of them participated, but we have to have not a bigger participation, but a participation in time. These periods or these deadlines are settled up by the European Commission, and we have to be able to help all of healthcare providers to get this information into time, because if we don't have it into time, then it won't be valid, it won't be useful, and we will not be able to provide it to the DG test. So that's an issue that we have to improve. According to the data obtained, as I mentioned before, there are still members who can provide additional activity for the network. I think that's something that we have to stress out in the following years. We have to strengthen the networks that every hospital, every healthcare provider belonging to TransplantChild have in their own hospital, so they are able to connect all the transplantation programs into that network, so they can feed back to TransplantChild. And finally, I want to point out the potential, the important key cornerstone that proof that was the validation of the data that we did in the Padua board of the network. It was very a key cornerstone in order to boost participation of the healthcare providers. It's important, I think, that we are able to show that those data makes a difference. And that was, I think, the feeling we had when we meet in Padua, and that's why we have had the possibility that all hospitals participated finally in last year's survey. So now, what's the current point that we are onto? Well, just we launched a new quality and safety survey. As you can see in the slide, it's the title of the email. It's high priority ERN monitoring indicators for 2019. You can see also that the deadline is the 2nd of March of 2020. And every representative have had this email, and we will follow up how they will answer to this survey in the following weeks. As I mentioned in the second survey, we have kept some items that are the same that we did in the first annual update. We have kept the activity of the pre-transplantation period that every healthcare provider do in each type of transplantation program. Again, the transplantation activity in 2019, if you have seen, we have the initial activity that was included in the application forms when the network was launched in 2016. We have the activity for 2017 and 2019, and we need the activity now for 2019. But at the same time, we have added additional items in order to have more information on what is the activity around the outpatient and follow-up activity of our hospitals. We have also asked that our hospitals provide us through this survey what is the plan that every center in every type of transplantation program have prepared in order to attend those patients that have been transplanted. We are referring to the number of visits that are scheduled during the first year, what interval, what it's done in every visit, and well, as I mentioned, that's an issue that we want to point out, because if we focus on the outpatient activities, then we will have a bigger picture and a more reliable picture on what is the potential activity of the network. Other issue or the item that we are also asking in this year's survey is again patient and graft survival. Again, that's the agreed specific indicators that we have established in order to evaluate quality of our activity. And we have also put into the survey a special section in order to collect additional activities that have been undertaken by the healthcare providers and that have the acknowledgement of TransplantChild. As coordinators of the network, we are periodically collecting activities that have this acknowledgement. Independently, they are reported or not by our healthcare providers, but we think that these surveys can also help us to collect additional activities that have been done that comply the criteria set up by the European Commission in order to be considered TransplantChild's activities, and that can sum up to the overall data that we collect. Those additional activities are clinical trials or observational prospective studies, accepted peer-reviewed publications in scientific journals, clinical practice guidelines, other clinical decision-making tools, conferences, congresses, and meetings. All of those have to acknowledge TransplantChild and have to have at minimum the participation of 2 hospitals from 2 different countries. Well, as I mentioned before, the survey has just been launched yesterday. We mentioned in the previous slide with items we are collecting in this second annual update. And as you can see in the slide, it's important to remind that the deadline that we have established that for all the full members that belong now to TransplantChild is Monday, the 2nd of March. We need to establish that date because, as you can see, there is another date established by the DGSMT, the European Commission. They have set up to all the networks, to all the ERNs, a deadline to collect all the data. That is Friday, the 13th of March, and we want to have an additional time between the 2nd and the 13th of March in order to collect the information and prepare it before we send it to the European Commission. The survey is available in this link that you have in the slide, but as I mentioned, an email has been sent to every hospital representative. And that's also important. You can see it on the slide. This is the first time that we will be able, that every European reference network will be able to collect into the IT tool that has been developed by the DGSMT. We will be able to collect the responsiveness of the ERN members. As you may probably know, being into every ERN, and TransplantChild is no exception, implies complying and achieving certain activities and the reporting of indicators, and that for every network is compulsory. So DGSMT would want to have this information collected by every ERN in order to follow up the involvement and participation of the existing full members, so they can let member states know how different healthcare providers are participating in order to decide their continuity or not inside every network. Well, just a final slide. As we usually do in every webinar, a message to take back home is that, as we have been talking through the presentation, continuous monitoring and assessment for all the ERNs is in progress, and it's important to stress out that TransplantChild has achieved in 2019 the participation of its 18 full members in the first annual survey. That the second annual survey has just been launched. As we mentioned before, every healthcare provider belonging to TransplantChild have to remind that the deadline for submitting the requested data is next Monday, the 2nd of March of 2020, and that this survey is quite similar from the first survey that was launched last year, but we want to focus especially on the outpatient activity performed by the healthcare provider members of the networks. Together, as I mentioned before, with any additional data that you may think can be related to the activities that TransplantChild is pushing forward has been pushing forward during last year. As we did last year, we will take the chance that next board of network is taking place next May the 15th and the 16th in Warsaw, Poland. And we expect to present the results and validate them in that board of the network. So we can have a second summary of results, and we can keep on pushing forward and stressing out what this network can add to the current needs of the patients all over Europe. So thank you very much for your attendance. Please do contact the coordination team at Hospital La Paz in case you have any question related to this webinar, and also related to this second annual update that we have just launched. We hope that you can participate smoothly in this second exercise, and we believe that if we keep the fort and joining all our forces together, we can get further. Thank you very much for the attention, and good afternoon.